My name is Megan Mardashti, and I'm one of the AOCPMR's Multimedia Committee co-chairs and your host for today's episode. Joining us today is the wonderful Dr. Gina Benaquista DeSipio, who is a osteopathic physiatrist with a specialty in neurorehabilitation and also currently running her private practice in Philadelphia. She is known for her trauma-informed approach to care and incorporating mindfulness and meditation into her treatment plans. Besides her clinical work, Dr. DeSipio is also a clinical assistant professor at the Philadelphia College of Osteopathic Medicine, where she actively mentors the next generation of medical professionals. We are delighted to have you with us, and I know I touched a bit on your background, but is there anything else that you'd like to share? And also, if you can talk a bit about your journey on how you ended up in the field of PM&R.
Thank you. It's so nice to be with you, Megan.
Thank you.
Wow. I feel very blessed to see my practice unfold where it's bringing together all these interests I've had even before medical school. And that feels really rich to me. I started out as a bio major pre-med like everyone else. And I just thought it was preposterous that they wouldn't let you take Calc 3 as a bio major. And so much so that I changed my major to mathematics
Oh,
to be
wow.
able to do that. um, and, they were very generous. They had to make a different degree in order to be pre-med. And they let me study the symmetry of viruses for my thesis. And anyway, I'm seeing how those patterns that I was looking at in nature and that mirror patterns that we see so much more beyond origin and insertion in my treatment like now. So I really appreciate that. I'm also a musician. And there was a point at which I became much more receptive in my osteopathic practice, and things felt like they were vibrating or moving or in some rhythmic motion. And to the point where I really feel like we have to hear the unique symphony of every person's all of the systems at once.
Right.
And that's probably an extension of my music background. And it just feels great to have all of those things together for me right now.
Mhm.
Like many people who go into physiatry, I loved a lot of things in medical school, and I felt very grateful to discover physiatry. Um, I went to Kessler for my residency and my fellowship
Mhm.
in spinal injury, where I had extraordinarily supportive attendings who allowed me to marry my osteopathic work in my residency for patient care and to share with my colleagues. And that was really a gift.
That's wonderful. That's awesome. I think, obviously AOCPMR, we are a DO organization, so that's always very refreshing to hear you have those opportunities, especially in residency when um, I think there's a lot of learning happening and it's so easy to put something like osteopathy in the back burner and just focus on um, the new lessons that you need to learn or the new just everything is new. So that's pretty wonderful. And talking about, this whole episode will be mainly focusing on osteopathic medicine and OMT. So would love to hear how, in your thoughts, osteopathic medicine contributes to the field of rehab medicine.
Very consciously in physiatric training, we learn to take a full history, to take into account not just the physical trauma that a patient has incurred, but also how that is impacting their social life or their relational aspects in their life. And even maybe their spiritual life as they start to really question the shift and how they view
Mhm.
themselves in the world. And I would say that osteopathy takes that to a four-dimensional perspective. We really start to look at what does this big crisis in someone's life trigger about their past, or how what went on in their past that is inhibiting their healing process now. And so, being an osteopathic physiatrist has really allowed me to amp up my ability to see the the factors in someone's life that really contributes to their healing, and also parts of their life that are keeping them from healing,
Mhm.
both of course with my heart and also my hands. And I think that's a great gift to be able to incorporate such a broad perspective and to be welcome to do that in physiatry because that's really part of the training.
Mhm. Absolutely. I think that was such a beautiful, holistic answer. Um, because and I think this is most likely one of the very first times anyone's touched on the fact that the more of the subconscious part of patients, spirituality, and it's not just, oh, I'm coming in to get this treatment and I will continue to get better, but there is the mind, body, spirit, and the other dimensions to our psyche that it might not be readily available to the patient to think about. And it's at times something like osteopathic medicine and our knowledge of that can bring those things to the patient's attention. So appreciate you sharing that.
Yeah.
Um,
I
so,
think
oh, go ahead.
just wanna, in our medical school training, we get
Mhm.
so much education on a somato-emotional release or a psychosomatic relationship. And those things really play out later, and patients don't know what gets stored in their physical. As you release a fascial tension and emotion comes up, um, they start to make changes in their life and heal things. And it's really helpful to be aware of that process. And especially when we're dealing with catastrophic injury, when people are taking a whole 180 look at their life differently.
Right, right. And what a beautiful view to be able to share with patients, right? Because I think a lot of times patients, a lot of people just forget that there's a lot more to medicine. And I think, especially at this day and age, many times medicine is just, oh, I go to the hospital, oh, I go to the doctor, I get this medication, I get this physical treatment, or and I think actually even it's more so medication, and then I get fixed, that's it, right? But with osteopathic medicine, we're expanding that viewpoint. We're adding more tools into our toolkit as osteopathic, well, for me as a future osteopathic physician, to be able to share that and even give more um, opportunities, and it give more of a option for patients as of what do you prefer. So I think that's beautiful.
A great point. I just want to springboard off of it. It's really important as osteopathic physicians, especially in physiatry, um, to outwardly empower the patient that the power to heal comes from within. It doesn't come from the doctor. And um, medications and interventions get us to a place where we feel safe that we can
Mhm,
then do the healing. Um, and so that's definitely part of incorporating osteopathy in patient care, is empowering them that the voice that they should listen to comes from inside them, and restoring the relationship
mhm.
of the patient to themselves.
Oh, that's such a beautiful, beautiful thing to highlight. Yeah, and I feel like I can go on and on about that. But yes, we are living at a very fast-paced world where not a lot of people take the time to even get to know themselves or just sit and reflect and really understand what goes on in their mind and body. And that's a beautiful gift that we can share with the patients. So thanks again for sharing that. Um, so you do pretty unique things in your private practice. And for instance, the fact that you utilize the trauma-informed care as well as mindfulness and breath work. Um, and I'd be interested to hear if your osteopathic background kind of ties in with that by any chance, or how with with the practices of mindfulness as well as your osteopathic background enhance your approach to patient care, especially in the field of PM&R.
I am a student of life, and so and I'm, as I continue on my journey, I'm more and more receptive to something greater than myself. And I would say my incorporation of mindfulness, meditation, breath work was just my observations with patients and my own life path. Um, I had a patient yesterday actually that I'd love to talk about now that would really highlight sort of the importance of incorporating those things and the ease and effortlessness that with which it happens. I had a young boy post brain tumor surgery. He's an adolescent, and he's done with all of his treatments. And they came in for osteopathy to help with vision impairment, and he's also constipated and not doing well sleeping, but an extraordinarily well-adjusted, articulate, happy, and a very supportive family. And after taking history and talking to this boy, I said to him, I explained what's going to happen, and I said, at any point, if you feel uncomfortable, I want you to be able to say, and we'll pause.
Mhm.
And when I got to his back, he immediately arched. And by the way, this is a patient who's got a shunt and a tube, and he's got quite a bit of
Wow.
software inside.
Mhm.
Um, this was not an area where there was any tissue texture changes or area of pain, but he arched and said, "Can we take a pause?" And in this process, as I'm listening, what's really very evident is there's emotional shock and trauma stored from just being touched so much. That's really impairing his ability to breathe.
Mm.
Diaphragmatic breath is really impaired, and it becomes an autonomic dysfunction um, in response to his whole process.
Wow.
That was really had to be the focus. And sometimes I use vibration and frequency. I have a love affair with Himalayan singing bowls, and sometimes I will utilize that, especially with kids. It can be fun and maybe just something that separates my hand from them. But
Mhm.
allowing him to feel vibration safely and to utilize, I make it up on the fly, but
Wow.
because it's unique. But for him, I really had him hum and move and safely relate to breathing and feeling safe in his body. And in that way, um, sympathetic chain ganglia are right behind the rib heads, and the abdominal ganglia are right below the diaphragm, and these are very artfully placed so that breathing helps to. He has a dog, so I said, it's like you're soothing your dog. It's like your diaphragm is soothing your nervous system, coming back into a safe space. And I didn't expect that was going to be the focus of the treatment. Of
Right.
course, I had all these other ideas about the posterior fossa, and I really wanted to free up anything that was tying up his vision.
Mhm.
That was really step one. And that's just attending to a whole person and remembering that someone is mind, body, spirit,
Mhm.
um, helps to guide utilizing those things in practice.
Right. And it really sounds like you take it at the flow and at the speed of what the patient needs in that moment. Because I think a lot of times it's very easy for us to have this preconceived notion of we see the chief complaint, we develop this idea of like, okay, this patient's coming in for this thing, this is what can be wrong within that. And then once you either see the patient, talk to them, or in your case, kind of listen to the patient's body, then that can really change your course of treatment even, which I think is just keeps it a lot more interesting and engaging, both for you as a physician, but also I think for the patient, because then they feel that, wow, I really did get this individualized treatment rather than, I don't know, like the mainstream of like, oh, for back pain, we all get this type of a thing.
Yes. Yeah, it's a really great point. Everyone is so unique. We're so used to in conventional medicine pattern recognition. These symptoms go with this diagnosis, and this is the treatment plan. But
Hmm.
everyone is such a unique individual. Um,
Right.
when we're focused on midline and midline in the osteopathic world, and you can think of midline as the spinal cord, you can think of, midline as our center of gravity, but that's really associated, as I've experienced and practiced, with starting to become on midline with your intention. And my real appreciation of mind, body, and spirit being so incorporated was not because it was a mantra that was taught, because I really saw when patients felt physically better, they
Hmm.
started to move into alignment with what they felt like their purpose to be. They could be more creative. There really is
Wow.
this healing that happens at one time, or if one area is sort of freed up, the other part of them gets to show up. So alignment and midline is really on all fronts, physically, spiritually, emotionally.
Wow. That's a very wholesome way of putting it because I think that just echoes the fact that we're not one-dimensional beings, mind, body, spirit, once again, and just osteopathic medicine is wonderful. Um, but like you said, if you have this one pain, whether that's somatic, visceral, it is limiting. And like you said, if you learn about yourself, if the pain is alleviated, then who knows how it can enhance your life, whether that's in a form of creativity, whether that's in the form of learning more about yourself and discovering things that you didn't think were possible. So that's really good to know.
That frees you up. You're
Definitely.
reminding me, the way you put that reminds me, I saw this one patient for chronic low back pain,
Hmm.
and um, we got sort of to the, for years, she had chronic low back pain, and we sort of got to the crux in a couple visits. It was sort of just waiting at the surface to be released. And,
Right.
mechanically, there was quite a few things, but there was other things happening. Anyway, what I was really surprised to notice to observe is when
Hmm.
she didn't have low back pain anymore, everything in the house started shifting. She has several children. She has a partner, and
Hmm.
then it freed up the partner to say, "Oh, hey, I'm not feeling so good." And
Hmm.
the relation, I now see some of the children, like everyone's issues start to rise to the surface when someone else's issues aren't taking up so much space. And so relationally, you start to see um, family dynamics change when someone's not so tied
Wow.
to a physical ailment that really ties them up.
Hmm.
Yeah.
So in a way, by treating the patient, you're treating whole family, and it makes sense because you have more brain space to think outside of, oh, everything's hurting, and just gives you almost a new perspective of what's going on in my children's life, what's going on in my partner's life, and definitely can enhance the dynamic of the family.
Yeah.
Wonderful. Um, okay, let's talk a little bit about developments or innovations. I'd be interested to hear, what do you foresee in particular with the application of OMM and PM&R?
I foresee very clearly one medical system that is osteopathic, really
Mm-hmm.
beyond the confines of physiatry. I'm sure you're seeing this in your practice. Patients more and more are experiencing more parts of themselves or looking for more parts of themselves. There's so much collective trauma on the planet right now. People are saturated with trauma, and they're like, okay,
Yep.
I've had enough. How do we heal this? And so people are really looking for what we would consider alternative methods, or
Mm-hmm.
um, psychotherapy or somatopsychotherapy has been more normalized, and people are looking outside themselves. And I think there's no better combination of all of that than an osteopathic physician. My
Mm-hmm.
allopathic colleagues all wish that they had gotten. I mean, I'm blessed. I'm in a really rich medical community where there's an
Mm-hmm.
osteopathic school, and um, so many people say, I wish that I had that education, just even in principle, and not so much, it doesn't have to be the manual practice. And so I really do foresee a healthcare system that is, in America, we have so many innovative approaches to life-threatening traumas, but it would be
Mm-hmm.
wonderful. And I do foresee that we can be much more, less reactive and much
Mm-hmm.
more proactive about health.
Amen.
Yeah, I think that's the direction I hope for, and that's the direction I see.
Yes. Preventative medicine. I think, unfortunately, the insurance system isn't, there's so many loopholes, or not loopholes, barriers to wanting to practice or wanting to have a preventative medicine. And from my understanding and what I've learned from my own research, many physicians who tend to value what you just shared, end up going in private practice because that gives them more um, space to truly practice that preventative medicine and be able to, I guess, bill and provide the type of treatment that might not be as feasible if you were to work at a hospital or not outside of a private practice. Is that correct, or would you say?
Yeah, I think that the current healthcare model that is continuing to go for profit, or sort of a very business model, is really far from health and healing.
Hmm.
And I think it's just a matter of time that that gets stretched so far that it doesn't work anymore.
Right.
Um, and I don't want to see what is happening where good healthcare time with your doctor is only available outside of the system, and then we just have such a dichotomy of access to care.
Hmm.
So I definitely reform is necessary. It was really unusual to go into private practice when I did 10 years ago. Everyone thought, wow, what are you doing? That is not, that's not recommended. But
Right.
you know, now a lot of people are, because it's just so hard to really have time with your patients and really pay attention. I think that model is gonna bust over time.
Hmm. Um, well, I hope whatever happens in the future is the same vision that you just shared and is in a more preventative style rather than, oh, this patient has already developed hypertension, hyperlipidemia, all these other chronic issues, and now let's help them because patient education and that preventative medicine not only can help with longevity, but just quality of life and man, it would be a beautiful world. It would be a much healthier medical system, but
It's
yeah,
coming. It's
look
coming.
forward to it.
Uh,
Um, okay. So I think one of the things we mainly touched on, first thing, I really, really appreciate how you integrated OMT and osteopathic medicine together because I think in the brain of a medical student, rarely when we think of osteopathic medicine, the principles come to mind. It's more so OMT, it's more so treatment. And I think our conversation so far, you've done an amazing job of bridging the gap in between those two. Do you have any advice for medical students who like to not only integrate and apply osteopathic principles, but also OMT in their future PM&R practice? Because I think a lot of medical students, I wouldn't say a lot, many medical students end up not using their OMT skills. So do you have any advice as to how we can incorporate it and also your opinion on why do you think this tends to
yeah.
happen?
Oh, those are great questions. Um, I love both those questions. I have at this stage in my development, I can see why there is such frustration for students who maybe not are not able to feel what they're instructed to feel, and they sort of abandon the whole thing. I think there's so many reasons for that that don't are not illuminated then, and I didn't see them. I have great friends who just sort of gave up then, and I
Mm,
look back now, and I think you really have to be in a place in your own growth and development to be receptive. And I think if you're not in that place in medical school, learning, not giving up, and really realizing that osteopathy is way more than being able to feel with your hands, being able to see with your hands, and really reflecting on what may be going on for you that you are not able to receive information, and knowing that it would develop over time. And it's sort of an invitation to grow more. Um,
mhm,
I think that can really I think medical training in general, in its optimal form, will include um, people staying curious and having self care and sort of being coming home to themselves, not so
mhm,
outward. Um, but and how to stay using your hands in your training with whatever your specialty is in PM&R is just to put your hands on someone. There's so many. My career started out in inpatient rehab. I spent most of my time in the hospital, and every patient I put my hands on, um, there's osteopathy at its worst is diagnostic. So if somebody has um, knee pain,
mhm,
and it gets better with your hands, and you don't have to image. But if it doesn't, then there's a whole other differential workup that you might do. You might be taking some care of someone with MS with constipation, and you surely need to change their medications and maybe look at their bowel program. But you can do so much with your hands related to mechanical barriers to voiding, or nervous system barriers, or mood and emotional. And so it's just really realizing that it only takes 5 minutes to feel and affect change, or just get someone on their neutral, um, and making it known to the people who you are rotating with that that's something that you really want to make time for,
mhm,
and entrusting them um, that you value the addition of that, not in place of what you're learning, but in addition to.
mhm. Absolutely. One of the things that you touched on was the fact that you brought up self-care, open or curiosity. And I think a lot of times in medical school, that can be out of the window, right? And the reason I say that, and it's very unfortunate, right? But medical education is very rigorous, and that, for instance, for me, one of the biggest promises I made to myself was I do not want to lose the fire and the passion that when I first started medical school to be lost by the end of my fourth year. And I'm currently, I would say, yeah, I'm in my fourth year, and it's 80% there. And I just think it can be very, very challenging for medical students, right? When there is okay, I have to study for this exam, I have to apply for this rotation, especially in third year where it's juggling work, studying for a shelf exam, taking care of yourself. And I guess depending on the student's priorities, for instance, for me, I have been practicing boundaries and self boundaries where I'm like, okay, I need to have a hard deadline at 9:30 p.m., whether that's, I'm not done with my Anki card, I'm not done with my questions, and make sure that I have a wind down routine. And I think that's been one of the things that's been very beneficial in me, staying on the more so not burnout. But when a lot of times people come into medical school and unfortunately we haven't done the hard work of what do I look like when I get very stressed? What does it look like for me when I'm burnt out? What does it feel like? What do I need to fill my cup? And those things can very much so be blown out of proportion when you're not equipped with the proper tools. And I hope this doesn't come across that I'm blaming anyone, but it's just because I had a gap here and I decided to learn more about mindfulness and what is it that fill my cup. And there is not much space in our medical education for that. And maybe there are medical schools who will provide that for students or who will give that space. But I think more so than not, and thinking about some of my colleagues, that tends to be how it is. So I think that sometimes, and even thinking about myself, like first and second year where I had more time, it was just studying. It wasn't like studying and working. And I was a lot more excited about OMM. So I think that could be why.
There are schools and osteopathic physicians out there already incorporating that into their curriculum. I do
Mhm.
because it's an interest of mine. And I really do believe that you're right. To be guided in that way, and especially in this high pressure time, is
Mhm.
really important. We do have to develop our humanity as we're dealing with humanity, and
Right.
including that we're all so young when we go to medical school. It's
Right.
we do need some hand holding in that, and the great and us medical education across the board could stand to grow in that, and I do think it will too.
Right.
You
I
touched on
I
a
re Go
thing.
ahead.
Sorry, I just self-care really is getting nourished. It's really
Mhm.
figuring out what puts you in a state of joy and awe. And that
Mhm.
brings us into homeostasis. And it could be 5 minutes or it could be an afternoon, but it
Right.
is learning what sort of turns you on, your light on, that nourishes
Mhm.
you to have the discipline to do the things you need to do.
Right. Yes. Yes, 1,000 times yes. And you mentioned a lot of us starting medical school young and not being equipped with the proper tools, which I very much so think is the case. And also, a lot of us haven't had any experience like medical school before. So it is a lot of figuring it out and staying curious, and less so entering a constant fight or flight mode and just being like, okay, I have to finish studying for this exam. What is the next thing? And just chasing a grade or chasing the end goal of I just need to get done. I just need to get done. And
You know,
hopefully, go ahead.
I had you reminded me of Dr. Patel. It's a shout out to Dr. Patel at the East Orange VA where I trained at Kessler. And lunchtime, we'd be writing our notes furiously. And he's like, okay, doctors, let's go for a walk. Walk every single day during lunchtime. And
Wow.
there are people along the way who had practices that were
Hmm.
simple, but sort of put you in that. I had another attendant on a rotation. We took a loop around his backyard between patients every single time we walked between patients
Wow.
time. And those, you as a upcoming resident can do that with your medical students and just sort of like change the game a little bit.
Yeah. Yes. We all have the power of change within us. And just as you are influencing the next generation, our listeners and I definitely have that too. So that's a great reminder to us all. So do you have any final advice that you would like to share with our listeners?
Mm. osteopathic education really gives you a broad perspective about the potential cause of things.
Mhm.
So just to bring it back to physiatry for a second, oftentimes people after a catastrophic injury or, I'm going to call it a simple car accident, you can see new onset reflux or new onset anxiety, new onset mood disorders or hypertension. And just putting your hands on patients and really feeling what that feels like, and then treating that will expose you to the reality of how much of that diagnosis is actually the body's response to trauma. And you can prevent that new hypertension medication. I mean, often there's such a slew of new medications in the concussion, brain injury, spinal cord injury world. Um, also, be creative. I remember when I was a first year physiatry resident, one of my attendings so kindly said, "Can you come take a look at one of my patients on a different service, neck pain?" And so I walk in and the patient's wearing a halo sitting up. And I'm all ready to do muscle energy or counter strain or side bend rotation, and we're in a halo. So there's no movement. I'm like, I don't know what I can do for neck pain. But just sort of getting creative and curious. I was engaging with the scalings without moving anything. I didn't think I was going to be able to help at all. But I was really, with whatever the movement I could feel or I could be with, and the neck pain went away. I learned something that I didn't expect the neck pain to go away. Um,
Wow.
or remembering that your quadriplegic patient after spinal cord injury, their headache may be from a sacral torsion that they can't feel or report. But remember, the mechanism of injury, even if their femur wasn't fractured, it could be an osseous strain in the femur that's really holding up their system and causing headache or anxiety. And just keeping in mind that broad perspective that osteopathic education gives us on in all diagnoses. Um, yeah, that's my advice, is just to keep it broad and always. Osteopathy is really just a mechanism to pay attention to the wholeness of a human, which is really the wholeness of humanity. It's just not so siphoned off.
Amen. Amen. A lot of times we get lost. This is my little saying of getting too lost in the sauce. And it's all about taking a step back, thinking of the bigger picture, like you said, thinking the mechanism of injury and seeing what you can do and just having an open mind going into it. So thank you so much for your time. I hope our listeners learn as much as I did. And thank you for all of our listeners for listening to this episode. And if you guys have a few seconds, please leave us a review on Spotify or Apple Podcast page and let us know what you guys like to learn about next in the future. Until next time.